We'll start with Commissioner Taylor. You inherited a very complicated and important issue when you left ACS to join DHS as the commissioner. And I guess this room would like to know, I guess as specifically as you can, what's your impression of the crisis you inherited? Mm-hmm. And from your perspective, how do you give us your sense about prioritization at DHS?
So Eric, thank you.
Yeah, my pleasure.
Thank you. I'm happy to be on this panel. I'm happy to be here with you all today. Can you hear me now? Okay. So let me lean into the microphone. So to your question, Eric, we are, as I think everyone in this room knows, we are addressing homeless, what I'm going to actually term crises in New York City, that is at levels that are unprecedented. So for those of you who don't know, I have joined DHS on January 13th, was my first day at the agency. I come from child welfare, where I had worked for 13 non-consecutive years, most recently overseeing child protective services in New York City at ACS. I took on this work and took on this position at the request of the mayor, wanting to continue serving families and individuals who were in crises, and wanting to continue working in Health and Human Services. And on behalf of fellow New Yorkers, I'm a New Yorker. I'm from Jamaica, Queens. I live in Harlem, and I am a very native New Yorker and very familiar with a lot of the issues that are presenting to people who are here. Right, so coming into a system that now has, as of today, over 53,000 individuals being sheltered across some 250 locations in New York City. It was a bit daunting, but I knew that it was work that needed to continue, and work that I was happy to participate in. So our priorities and our focal points. I have to start with what has been perhaps the most significant issue that I have faced since coming to this position. Actually, I was announced in this position on New Year's Eve, December 31st. I was still working at ACS, and that day, as soon as the announcement ended, I ended up on a phone call with the state, with the Commissioner of OTDA, Commissioner Proud, talking about capacity, talking about shelter capacity within our system, and having a conversation about our need at the time to shelter individuals who were in our system and who were coming into our system, and our limitations with respect to having sufficient capacity. So at the outset, the very inception of this work, I learned that one of the most important things that we needed to attend to was to be responsive and to meet our obligations pursuant to the right to shelter. Does that sound familiar, Steve? Pursuant to the right to shelter in New York City, which is the right thing, right? Obviously, there are a lot of people who are in need, who don't have anywhere else to live, and who need a place to live and a place to be until such time as they can be permanently housed. So capacity management and taking on kind of the wealth of capacity with our providers as well as our direct run sites was one of the very first focal points that we had to attend to in very quick order. And it's an issue that even as of today, as the summer months are beginning, we realize that there are more families coming into shelter during this season than there typically are throughout the year. Just as a point of reference, I watch the numbers every day, and I can tell you that over 100 families with minor children applied for shelter at PATH yesterday, right? And when you think about over 100 families with children applying for shelter, to come into shelter, that's a large number, right? So in the month of May, I think the number in its aggregate was somewhere about 2,500 families with children entered shelter in New York City. Right? So when you think about that, the task is one of, understanding what is the root cause for people becoming homeless, and how do we as a sheltering agency attempt to address that. One real area of focus is really considering homelessness prevention, and particularly our home-based model of practice that we are delivering over 14 locations in New York City, and delivering more of it. Right? So if we don't stem the tide of new shelter entries, if we don't find a way to work in partnership with our sister agency, HRA, and other agencies that can participate in this goal to keep people stably housed instead of them having to come into shelter, if we can't work on the front door, we're going to have a real hard problem that we already have addressing the full wealth of individuals and families who are in shelter right now. So one priority was to expand home base, and I'm happy to report that we have secured additional funding in the executive budget that will allow us to open more home base offices throughout New York City. And we believe that if we can expand our reach, that we'd be able to hopefully keep more people stably housed and ultimately prevent them from ever having to come into shelter. That's goal number one. Related to that as well is work that we're doing in partnership with HRA and anti-eviction services across New York City, and the decision that was made to consolidate all of the anti-eviction contracts into HRA's portfolio. So starting on January 1st, that is going to occur, and I believe that Commissioner Banks will tell you more about that in his remarks. But bringing to bear all of those resources and having them consistently administered across one city agency to all those who could use the assistance of our anti-eviction programs was something that we decided to do in very quick order. So the 53,000 individuals who are in shelter, may have heard of, some of you may have heard me speak before, and you may have heard me say that we're very interested in understanding the conditions of shelter. And the conditions of shelter beyond what was reported in the New York Times article concerning the child Dasani and her family who was in one of our direct run shelters at the end of last year at Auburn and Brooklyn. And I'm talking more than just brick and mortar. I'm talking more than just physical plant conditions. Yes, we absolutely have to be attentive to what those are like. But another focal point for me and for this administration is understanding what are we doing qualitatively in terms of casework practice, in terms of casework with families and with individuals who are in our system. And one goal of mine is to really work with our providers and to identify what the best practices are, to work with our staff at the agency and to structure and develop what I'm calling a model of practice across our portfolio of shelters for single adults, for adult families who don't have minor children, and for families with children. And why do I want to do it? Well, I want to do it because for families with children, for example, the average length of stay in one of our shelters is over 400 days. So if you're in shelter with us, one of our provider agencies, for over 400 days, that's a real opportunity that we as a system need to capitalize on to understand what are your barriers to housing and how can we assist you in developing an independent living plan that is tailored to you and to your needs in order to get you stably housed and out of shelter. And I think that this is work that the agency certainly has begun before I got there, and I think we're going to deepen it during this administration, and there's a real interest on our part to attend to it as part of conditions of shelter. Are you cutting me off, Eric?
I'm sorry?
Are you cutting me off?
No, just foreshadowing.
All right, I'm just saying. You can hold up a little sign. Make me nervous. I'll be quick. I'm moving along. Okay. So conditions of shelter is a real focal point. And the casework that's being done by our case planners and our case managers, and the support that we're giving our provider network to understand what their needs are so that they can best deliver services to our clients across the portfolio. For single clients, our adult families, and our families with children. Another area of focus that is clearly important and I think aligns well with today's conference is really exit strategies for families and for individuals who are in our shelter systems, right? So on the single side, supportive housing is one of the best resources that we can tap into in order to effectively house single individuals. We have a lot of people in our system who are in need of some support beyond shelter exit, to help them remain stably housed, with some support in terms of transitioning back into their communities. And supportive housing programs are those that we rely on very, very heavily. My staff who are in the audience, they know that this is a conversation, and this is certainly a bedrock of the resources that we have in our toolbox to help us to exit individuals from shelter. And we're going to rely very heavily upon it, as we have done over the years. And we certainly know there's a need for more supportive housing development within New York City, and I think it's been referenced in the mayor's affordable housing plan, and it's something that we're definitely going to pursue. We are also going to pursue NYCHA, New York City Housing Authority, and having some access to those units. It was announced as part of the chair's testimony that we are working very closely to access units for families who are in shelter sooner than later. right? And I know they have to do some amendment to their annual plan, and I know that there are staff who are working right now, today, to look at clients who are in shelter who are certified to certain lists in NYC in order to move them into NYC units in public housing, to once again become a resource for all of those who are in shelter as possible. We're also looking at rental assistance and rental subsidy. And we were fortunate enough with the support of Councilmember Levin and with the support of our partners in city government and with the state to have language changed in the state budget that had prohibited us from using state money in order to subsidize rental assistance recently, as of April 1st. So with that language change, it's cost neutral, and we have to identify places in which we can perhaps yield savings in order to structure a plan to reinvest some of our shelter dollars into subsidy to help families exit from shelter. And the two populations that we're focusing on, the first population would be working families. And so that you know, we have about 25% of our families with children who are in shelter have a head of a household who works every day, right? Full time, right? And if you think about it, if someone's getting up every day, going to work, making the effort to try to support their household, because of whatever constraints there may be or limitations around how much they're earning, if we can find a way in which to support their efforts, then we as a city want to do so. Sure. And so targeting the working families population is one, and the final one, and then I'll pass the podium. The final one is looking at ways in which we can subsidize exits for clients who we have described as being vulnerable populations. These are episodic shelter users. These are families who've been in shelter more than one time, who we know in order for them to effectively exit shelter and remain stably housed, they need some additional support on the back end of that exit. So looking at models of practice in order aftercare to really help them to transition back into permanent housing is something that we're committed to exploring and funding for some population of clients who we hope to be able to exit. So we have a lot of things that we're working on right now. Those are some highlights, and I'll turn it over to you.
Thanks, Commissioner.